Everyone. Welcome to the EPI seminar series. I am Terry Lewis. I am your substitute moderator for today's presentation. It is my absolute pleasure to introduce Dr. Ali Rowhani-Rahbar. After reading his CV and a couple of his recently published articles, I'm a little starstruck and some tongue-tied, and I'm going to slink back to my office and review my productivity. But in the meantime, please forgive me for the obvious reading of his biography, as I want to be sure to touch on many of his accomplishments. So Dr. Rowhani-Rahbar is the Bartley Daub Professor for the Study and Prevention of Violence, Professor of Epidemiology, and Adjunct Professor of Pediatrics at the University of Washington. His broad goals of his research are to inform equitable policies and population level programs that prevent the occurrence and reduce the lethality of interpersonal violence and self-directed harm. He has authored more than 150 peer-reviewed articles on violence prevention and injury control. His research has been supported by the CDC, NIH, Department of Justice, National Collaborative on Gun Violence Research, Arnold Ventures Fund for a Safer Future, as well as state and local funding there in Washington State. He serves as a member of the editorial board of Injury Prevention and as a section editor for Current Epidemiological Reports. He received his MD from Mashhad University of Medical Sciences in Iran, MPH from Yale University, and PhD from the University of Washington. He completed his postdoctoral fellowship at Kaiser Permanente Division of Research, Centers for Disease Control and Prevention, and Stanford University. He will be talking with us today about the role of income supports and interpersonal violence. We'll have some time at the end for Q&A, so if you have any questions, you can put them in the chat box or jump on jump in, I should say, at the end of his presentation. And with that, I will pass it over to Dr. Rowhani-Rahbar.
Great. Thank you very much for that introduction. Please let me know if you can't hear me well or any audio or video issues. It's about 2 years now. We're all familiar with this. So as you mentioned, I'm going to talk to you about violence prevention through income support. That's one angle of my research program. I will talk to you for about 40 minutes or so, making sure that there's some time left for Q&A, but the topic is really big, so I'm happy to pick it up after the presentation today via email or one-to-one meetings. I'm happy to continue this conversation with you all if you're interested. I thought maybe I would start with this graph that some of you may have seen. I assume the audience here are a combination of different colleagues and students and trainees and different departments or divisions within the school or maybe from the community. This is a very highly informed audience. So you all know the power of public health, and you probably all know that different forms of violence, which is a public health issue, intersect with each other over the life course. And so this simple yet powerful figure from the CDC really shows across the life course from birth to death, there are many different forms of violence that occur, and they can all intersect with each other. That's important because that realization makes us understand that there are certain risk and protective factors that could be shared between all these different types of violence. And so there's some initiative by the CDC and the federal government as a whole to really think about different forms of violence and how they intersect and how we can prevent maybe more than one form. And many of you are familiar with the social ecologic model and different layers of the onion, from the individual level to peer to school to community to society. And so I don't want to go through all of that because I assume that you're familiar with that. But these are just some of the types of violence that we can study and, let's say, relationship level factors that may have a bearing on them that have been empirically studied. Or when you think about the societal level at the very, very outer layer of the onion, you will think about big, broad policy and law effects on different forms of violence. So equipped with this, obviously, really important knowledge and what we need to do further to really prevent the burden of violence in our society, our group and many, many other groups in the country, although not enough, have looked at some of policies and their impact on different forms of violence. This is one example of our prior work, looking at the impact of the Medicaid expansion policies on child maltreatment. I'm not going to talk about that paper today, but I do want to talk about the commentary by one of our colleagues, Dr. Kristen Campbell, pediatrician, who wrote a really nice editorial on this. And really just an excerpt from that Dr. Campbell says that for decades, many have hoped for a comprehensive approach to the primary prevention of child maltreatment. Over and over, we are presented with early evidence of program efficacy. Effectiveness may be established, followed by the challenges of replication, fidelity, and adaptation required for widespread implementation. Many of these programs provide meaningful and needed services to the vulnerable families around the country and are sustained by local champions and variable funding streams. However, for state policymakers tasked with the almost impossible charge of balancing the needs of young and old, vulnerable and comfortable, and healthy and sick populations, this parade of child maltreatment prevention programs may appear to provide marginal benefits to a sliver of constituents with substantial upfront investment to be recovered only over the course of a generation. So what if the prevention of violence can be an unanticipated bonus of a social or economic policy rather than, or in addition to, the primary objective of a prevention program? That's a really powerful and important question. So this could set up lots of research projects looking at different types of policies in relation to different types of violence. So a few years ago, the CDC came up with a NOFO, Notice of Funding Opportunity, that sought to evaluate the impact of one policy, just one policy, on multiple forms of violence. And by forms of violence, they specifically meant suicide, youth violence, child maltreatment, sexual violence, and IPV. And so we got together with a group of colleagues at the University of Washington and brainstormed what kind of policy we were going to look at. And so we went through different types of policies, looking at the literature, what has been studied, what hasn't been studied. We were thinking originally about anti-bullying laws, but then we saw that a good amount of research has been done on some of these outcomes for that, and some other considerations. So ultimately, we chose EITC, or Earned Income Tax Credit Policy. EITC is a tax benefit designed to help low-earning working people, and especially those with children. Other members of the research team are listed here. This was a wonderful collaboration with our doctoral students, our postdoctoral trainees, our colleagues in the Evans School of Public Policy and Governance, and pediatrics and epidemiology. So we received this U01. It was a cooperative agreement with the CDC, a U01 that just ended 3 months ago. We established a theory of change model that how we think EITC may impact different forms of violence. EITC, when you think about this bifurcation, is hypothesized to induce an impact, a positive impact on income and employment. So clearly it's a tax credit, so it provides financial incentive to also work, because it's a tax credit that is given only to working people. And so it has been shown in the past that it does have an impact on not only raising the income, but also encouraging people to get a job and be employed. And so, like any other theory of change model, this is not perfect. It's just completely human-made. And I'm sure there are many other ways by which EITC may impact some of these types of violence. But this is a starting point that, through its impact on stress and especially the dynamic of the family, EITC may prevent several different forms of violence. This is the structure or the shape of the federal EITC, and some of you may be familiar with it. It's something that you can't forget when you see the structure of EITC. So you receive this, you file your taxes, and you receive this benefit. The benefit that you receive, the credit that you receive depends on a few factors. One is on your earning. The other is how many children you have, and the other one is marital status. Those three are the three main determinants of how much money, how much credit, tax credit someone receives. And as you can see, there is a crescendo, there is a plateau, and then decrescendo is here as you see the phase out, like phase in, plateau, phase out. So as somebody's earning goes up, EITC phases out. And you can see the profound impact of having children. For people without children, the amount is small. For people with children, the amount goes up. And it's a chunk of money. It's a notable amount of money. This could be more than $6,000, which could be profound for many families and could result in change, important change in their life. So the federal EITC has been in place since 1975. It's a wonderful, big program. More than 25 million eligible tax filers received almost $63 billion in federal EITC during the 2019 tax year. The average EITC per tax filer was about $2,500. Workers must file tax returns. The good thing, especially for research perspective, from the research point of view, is that it does have good coverage. About 80% of eligible workers claim EITC. It's not perfect. For the remaining 20%, there's a lot of room for education. These are people who are losing this opportunity. And so, in fact, Robert Wood Johnson Foundation last year came up with a RFA to really focus on the procedural or programmatic aspects of EITC to really make sure that this number gets as high as possible. But again, compared to some other types of policy for which the coverage is pretty small, maybe 30% of people, 40% are treated or exposed, this is pretty good for a policy. And EITC has been credited with lifting millions of children out of poverty. To just give you a good sense of how much money we are talking about, I have pasted this table on this slide. So you can see, depending on the number of children, for example, what is the minimum and what's the maximum what's the maximum credit somebody could receive, depending on whether they're single or married. And so it gives you a very good sense of that. And this has been subject to some changes lately, which I will talk about briefly, but it will give you a very broad global sense of what we are talking about here in terms of the credit. Then Rhode Island became the first state that enacted state EITC in 1986. So this is the map of state EITCs. So these are typically a percentage of the federal on top of the federal. 30 states in DC and Guam and Puerto Rico and some municipalities have EITCs. It could get very complicated with detail, which I don't want to go through all of that, but this gives you a global picture of what we are talking about here. Most of these states have what's called a refundable state EITC, which means you will receive credit even beyond your tax liability. Non-refundable stops at your tax liability. It washes away your tax liability, but stops there. Refundable goes above that. And so different states typically have a percentage of the federal as a state EITC that gets added to that, and it's helpful for state taxes. So it provides an additional benefit to the federal credit, especially for low-earning working families. It could be very large too. In California, for example, again, millions of families benefited from millions of dollars in this. And state EITC eligibility requirements typically match the federal. It's not exactly the same, and it varies from state to state. There's a lot of small font here, which I don't go through all of that, but typically it mimics the EITC structure at the federal level. And as I mentioned, typically is a percentage. For some states, it's just a few percentages. For some states, it's a large percentage of the federal. That also is provided as a state EITC. So hopefully with what I've just mentioned the past 10 minutes, I've provided compelling argument that this is a great setting for a quasi-experimental investigation of the impact of EITC on different types of outcomes, colleagues in public policy have been studying EITC for a while now on outcomes such as education, employment. But again, violence as a form of health, as a health issue, has been relatively neglected. It's only the past 2 or 3 decades, especially after reports by Surgeon General and Institute of Medicine, that violence has somewhat shifted in terms of the way people think about it from a criminal legal system, criminal justice system issue to a health issue as well. So there is a lot that we should do and we can do to study violence. So the U01 that we got funding for had 3 aims: to look at whether, for whom, and why EITC may impact different types of violence. And so these are different aims of this study that we try to address. One of the most important questions that come up, obviously, right off the bat, especially for epidemiologists or people in public health, is exposure measurement. So we epidemiologists talk about exposure measurement all the time. And exposure measurement here is tricky. This is not just like a drug or 1 and 0 or a lever that you just say on or off. It could take many different forms. It's not straightforward at all methodologically. You could start with something as crude and simple as a dichotomous variable. A state has EITC, a state doesn't have EITC. But you may say, well, that's quite crude. That's not really methodologically strong. Why don't we do a trichotomous variable? They don't have an EITC, they have a non-refundable EITC, and they have a refundable EITC, right? So that's a little bit more granular. But you may say, no, I'm not going to stop there. That's not enough, because not every state EITC that has a refundable is the same. You're totally ignoring variability by the amount of money. So you could look at generosity of the state policy, and you look at, for example, the maximum amount that a family can receive, or what was the percentage of the federal in that state. So people who lived in the state, and in this state, the percentage of federal was this versus another state. And another form is the simulated EITC, which is the most modern version of it, the most sophisticated version of it, which I will talk about a little bit. If you're interested, I'm happy to share how it works, but it's another way of calculating the generosity of EITC. So you could think about other exposures in your research, whether it's cardiovascular research or genetics or infectious diseases. Sometimes exposures are difficult to measure, or there are many, many different ways of measuring an exposure, statistically speaking. And they have different meanings, and they may have different implications. So to just give you a sense of the heterogeneity about state EITCs as a percentage of the federal, you see it's not the same. It really varies. This is a couple of years old, but we see in 2017, this has changed right now. The spectrum is even wider now in terms of states having very different levels of the percentage of the federal. This shows the state generosity, EITC generosity over time. You don't need to really read this specific state. I just want to give you a broad view of the generosity may also change. The generosity is not always the same. Sometimes goes up, sometimes goes down, depending on the state legislature. These things are dynamic. They are not fixed. And so that's another way of calculating it. In the simulated EITC, which I talked about, which I don't have time to go in detail, but I'm happy to share the literature on it, sometimes called parameterized difference in difference, or PID. What you do is that you employ data from, let's say, an external data set, and you construct a cohort of people who have the same number of children, the same marital status, and with certain earnings, and you run that cohort through some software like TaxSim, which is a software that you could run a cohort through it, and it will essentially give you the amount of EITC that people who have those features, that characteristics, would receive. So you calculate that externally, and then you attach it to your data set. And you would say, for families who have 2 children, and this is their marital status, and this is their earning, This is the typical, within that state, within that year, this is on average how much EITC they receive. So almost like an intent to treat. The benefit of this approach from the causal inference perspective is that it combats the issue of endogeneity. You're not using the person's earning itself to determine EITC for them, which is endogenous. You're rather using something as an exogenous variable, exogenous piece of information. You bring it to here to combat the issue of endogeneity. So this is a picture that shows for each state over the years when we generated, simulated EITC, how the numbers look like. So this is another way of calculating EITC, because the majority of data sets that we had access to, and they exist, they don't have a variable on EITC. When you look at the data sets that are out there in health sciences, they don't have EITC. It's not as if you actually have the value of EITC for participants. You have to estimate or calculate it in your data set. In fact, these are the 11 data sets that we used for this project. None of them has a variable for EITC specifically. It's not as if you know the variable, the exposure. And so we use these data sets for different purposes, as you see in front of their names. And we made use of them for different risk and protective factors for violence or for violence outcomes. And current population survey, the last one, was used for EITC simulation, as I just described. So how do you analytically go about this? So the main analytic goal is to use an exogenous or quasi-random variation that occur as a result of policy change, and use that as a measure to see how violence varies with regard to that. And so for this study, we had two levels. We had the state level. So these are typically, as you know, stacked cross-sectional data that are multiple times collected. They're not on the same person, right? So BRFIS, Behavioral Risk Factor Surveillance System. It's not longitudinal at the individual level. They select people over the years. They're totally different people. So it's not longitudinally tracking the same person, but it's longitudinally tracking the state, if you will. The other way would be to look at individual level data. So when they actually track individuals over time, repeated measures, multiple measures, the classic longitudinal correlated data, which many of you are familiar with, and you have analyzed these like fixed effects, random effects, etc., which many of you are familiar with in epidemiologic research and health sciences research. So let me walk you through the findings very broadly. We found some impact of EITC significant, especially in terms of decline in child neglect, specifically and overall in child maltreatment. Some decline significant in suicide attempt and suicide death. Those are the percentages on the relative scale. And you also see in the blue and the purple box, some of them are on the absolute scale. Over and over, time and time again, looking at 2 or 3 different data sets, we did not find an association between EITC and intimate partner violence or intimate partner homicide. And so we hypothesized why that may be. And part of it we hypothesized could be because of the intricacies and challenges in terms of the implementation of the program, that EITC and the dollars may not reach the survivors and victims who may actually need them because of financial controls. And some of the oddities or some of the unique idiosyncrasies in terms of how these are actually implemented. For example, victims or survivors who file taxes as married filing separately, they're ineligible to receive EITC. So that could be a hurdle for that. Some states are addressing these, like Massachusetts, but that's something that we found consistently a null finding as it relates to IPV or IPH. And so we have published on it and happy to share the results with you. We are working on publishing a couple other outcomes, youth violence. We found some, the same type of relative, the same sort of, in terms of scale, in terms of the degree or magnitude of reduction, very similar to other types, anywhere between 3, 4, 5% reduction, which to me personally makes sense. I would not have expected a policy like this to reduce these outcomes by, say, 20, 30, 40%. That would have been, to me, too good to be true. That probably would have been an indication of confounding going on. But this seemed reasonable, if you will, like a sanity check. But some of these relative reductions, like 4%, 33%, 5%, they could be very profound when they are translated to absolute terms in terms of, let's say, a very common outcome, as you all know. So a reduction or a policy that cuts the rate of something like neglect, which is so common in this country, by 3%, 4%, child neglect, that's big. That's very profound and important. We also looked at risk and protective factors for different types of violence, such as physical health, mental distress, which is quite important. And we found significant association with some of them, especially when we looked at the time of the year when the dollar amount is received. So the sensitivity of this study improved when we looked at the time of the year when they receive the benefit, because when you think about it from the causal inference perspective, and especially because research has shown that families who receive the credit, you typically use it as a lump sum immediately. Let's say a survivor or victim who may want to leave an abusive relationship, or somebody who may want to buy something for their kid, they use the $3,000, $4,000, $5,000. And so it's important to look at, let's say, February and March, as opposed to, say, October or November. And so when we focused on that, or used subgroups for whom we thought the likelihood of receiving EITC is higher, so they're likely treated, for example, people with lower educational attainment, we saw that the point estimates went up, which is consistent with what you would think if there is a causal association, because in the group, during the window of time, in the group who is most likely to be treated, in the window of time that you think is ideologically most relevant, you would think your point estimates would be greatest. And that's exactly what we saw. So it's 11:30 here, Seattle time. Let me use the next 10, 15 minutes of my time here to focus on child maltreatment as one of the outcomes and go a little bit deeper into how we did this study. Many of these are also generalizable to other forms of violence, but I wanted to show you the mechanics of one of the outcomes, which is child maltreatment. Okay, so why studying child maltreatment is important in relation to poverty? Well, it's been shown that EITC can lead to reductions in poverty and maternal stress, and these are risk factors for child maltreatment. Does EITC actually reduce child maltreatment? It's an empiric question. Can we actually look at it by those mechanisms I mentioned through the theory of change? EITC is important when you think about the global context here, in the US global context, I mean. It's a big program, among other programs, a key component of US safety net, and lifts millions of children every year from poverty. And so it's important to look at that. There is literature on EITC in maternal and child health, infant and maternal health, low birth weight, infant mortality, chronic stress and depression, not so much on violence. There are just 3 or 4 reports there. Some of them, for example, pediatric abusive head trauma, a fraction of all types of child maltreatment that her great colleague, Dr. Joanne Calvins of CDC did, and a couple of other papers on that, foster care and others. But there was no study, to our knowledge, updated contemporary study using large data set at the national level to look at EITC and child maltreatment. So we used NCANS, which is one of the largest child maltreatment data sets in the country. Some of you are very familiar with that. It has its own limitations and strengths like any other data set. And we looked at reports of maltreatment, screened in reports of maltreatment per 100,000 children by child age, because we hypothesized that the age may matter, and different types of maltreatment. Most of maltreatment types, as you all know, is neglect. a large fraction of them is neglect, and other types of abuse are, other types of maltreatment, that is abuse, are smaller. So we would expect, especially because earlier studies like Medicaid expansion had shown to be effective for preventing neglect, we thought that neglect probably would be the outcome that would be moved by, would be prevented or reduced by EITC. And so these are some of the distribution of screened in reports for 100,000 children for child maltreatment that you see. Again, it varies across different states. In this type of analysis, difference and difference, when you look at changes over time and you contrast the difference in your outcome between exposed before and after and unexposed before and after, confounders are those factors that also vary over time, and they're associated with that change in your exposure, and they're also associated with your outcome, right? So longitudinal confounders are different from cross-sectional confounders. So you need to look at those covariates and see how they change over time to gauge their potential to be a confounder of the association between exposure and outcome. So these are some of the state policies and paid family leave or TANF or gross state product and others that we look, minimum wage, that we looked at that also changed concurrently with EITC, and we should take control of them, we should take account of them and them into account, because if we don't, then we may attribute the effects to EITC. Well, actually it was because of, let's say, TANF or because of something else. So this is the regression model that many of you may be familiar if you do this type of work. This is called a two-way fixed effect classic regression model, where you typically have fixed effects for time and you have fixed effects for geography, for a state, for example, here, a unit. And then you have a matrix of covariates, which is shown here by X. And then you have the parameter that you're interested here, which is beta here, the state EITC for each state S and for each state T. So EITC sub S sub T. And the coefficient that you get for beta, it is the coefficient of interest. So this is the most classic, most popular regression type of regression model that you run two-way fixed effect to examine the effect of a policy. And that's what we used, with some variations, obviously, with event studies and others, which I don't have time to go through all of that. Now, in the past few years, for those of you who are interested in policy evaluation, as you may know, Andrew Goodman-Bacon has done amazing work, sort of a sea change in how we think about difference and difference. Seemingly simple strategy, analytic strategy, extremely complex, it turns out. And so he really has done amazing work to really show how when different states or different units adopt exposure in different time, some of these two-way fixed effect models may be biased. It would be good to also do sensitivity analysis or the analysis that gives weight to different units and follow them over time. So we are doing some of that analysis as well. Sometimes it does make a difference, sometimes it does, but I wanted to make sure that I share that with you all. So the pattern that we saw, as I showed you before in that graphic before, was very actually consistent in terms of the impact on neglect and no significant impact on other types of child abuse, child maltreatment, including abuse. And we didn't really see notable differences in terms of the magnitude of impact by age, which was a little bit surprising, because I would have expected maybe a larger impact among younger children, but there might be a mechanism by which EITC also provides benefit for adolescents and younger and older children. But we saw about 9% reduction in neglect. And so this is important because when you think about the rates of neglect in this country, this is only until 2016, and how the rates are changing. And of course, this doesn't include the entire pandemic period. I haven't even talked about the whole pandemic situation and its implications for this. You can appreciate that this is a really, really important problem and something that the trends definitely are in the wrong direction. And so when you put it in terms of numbers, the estimated annual economic burden due to child maltreatment is something like $400–500 billion. criminal justice system, special education, all that. So you can appreciate that the Eitc can play a really, really important role in reducing child poverty and then also child maltreatment. We have published several studies on a variety of different outcomes and risk and protective factors. We have some that are ongoing and hopefully will be published soon. I'm happy to talk to any and all of you on this, maybe offline and after this conversation. One of the things that we learn in schools of public health is to not forget that there are communities that are actually affected by the things that we study. And so not stay in the ivory tower and try to translate our work to real world. And so we decided to definitely do some dissemination for this type of work. We published articles in journals and magazines that would reach policy and practice colleagues, and also with institutes such as Washington State Budget and Policy Center and others who were disseminating these results, and they speak in front of the legislature to promote particular types of policies. Columbia University used some of the findings of our studies to really examine the Biden administration's plan for some of these child tax credit and other types of credits that are available and are getting expanded these days. And so that was another way that when the results were published, they were used, that the pieces of it were used for cost-benefit evaluations of some of the policies that were proposed the past couple of years in terms of how to combat the issues around the pandemic. Like any other project, we also faced challenges, and I have listed some of them here. You notice I didn't talk much about sexual violence. The reason for that is getting data on sexual violence is really, really hard, really hard. There are not good data sets, at least to my knowledge, on sexual violence that would lend themselves well to policy evaluations. There is, for example, NSVIS, which is a national survey done on sexual violence by the CDC. But NSVIS, has 2 or 3 data points right now, and all after essentially 2010. So it really doesn't provide the repeated measurements that you need, that you have, for example, with BERFIS or YRBS or others that would allow you to evaluate tracking of people or states over time. The same for many other sexual violence databases that have questions on sexual violence, but they don't lend themselves well to a rigorous long-term longitudinal trajectory analysis. You could do cross-sectional studies, but cross-sectional studies of policies are really hard to really make sense of in terms of causal inference because you haven't looked at change. The other challenge, obviously, is, as I mentioned, there are no data sets with EITC in them, to my knowledge, or if there are, like fragile families, there's a question, did you receive EITC or not? But it's very limited. And so you have to estimate with some creativity how much EITC this family would have received, like an intent to treat. Socioeconomic status and all the elements of structural racism, institutional racism, different types of racism, we haven't done a good job collecting those data over the years. It's all over the place, as you know. Just the variable race itself, as you know, is a mess. And so you don't see similarities across different data sets in terms of the measurement of some of these variables. And that makes it a little bit hard in terms of the harmonizations of the efforts. Some of them you need to go to a federal research statistical data center. You actually need to go in person to look at the data, which, in the age of COVID, it's harder. And also just sometimes it's not easy to go to those research centers. It takes federal research data centers. So you have to become an employee of the census. And sometimes that takes a lot of time to get special status to go get the data and analyze them with the identifiers. Some data sets like HCOP are great because they have the universe of all ED visits and hospitalizations in state reading ICD codes, but they're expensive. If you want to get all the state HCOPs, it would be more than $150,000, $200,000. It can break your budget, your grants budget. And also some of them don't have timestamp, like YRBS doesn't have the date of interview, And so that really makes it hard to know when the person was interviewed in relation to when they received the ITC. In terms of future direction, I think there is a lot of work for this to be done, methodologic work, substantive work, lots of great, wonderful causal inference work that can be done with this moving forward. EITC is just one policy. There are many other policies that may interact with it. We try to study these things in isolation and control for everything else. That's not how the real world works. Things interact with each other. So studies that look at combination of different policies are really important. I think that this project is now over, but I think there are wonderful opportunities with everything that's going on, which requires perhaps its own entire lecture, and by an economist, not somebody like me, to talk about all that is going on in terms of the American Rescue Plan and all the expansions of many of these things, and the opportunities that the future present for studying these things in relation to any health outcome that you're interested in. I'm studying violence, but you may want to study something else. And so these are really important. And lastly, I would say the importance of global thinking, the importance of big picture thinking. That I focused on EITC in the past 40 minutes, but you all know the picture is more complicated than that. There are many things that come together, for example, for the production of child health. How child health is produced. So many different things come together. Some of them you see on this list that exert and influence their impact on child health. And so to the extent that we could utilize our knowledge across many of these things together in a synergistic way, the better we can make sense of it and understand it and save lives. So with that, I am done, and I'm happy to answer any questions you may have or elaborate on any aspects of the work.
Thank you so much. That was just in my own experience looking at just kind of one topic of interpersonal and direct violence in the area of child maltreatment, not sort of having an appreciation for the multiple other forms of violence, even though I'm clear that those things always intersect. Having policies or interventions that cut across those multiple forms of violence is just really interesting and how impactful it could really be. I want to encourage everybody to jump in and ask some questions, and you can raise your hand or put a question in the chat, anything that works best for you. I did have one question just to sort of start off in terms of the earned income tax credit. So that sort of reduces tax liability and or may result in a refund. What do you think would be the difference between reducing tax burden versus more direct payments? For example, like the expanded child tax credit that some families are receiving now.
That's an excellent question, and something that I think is a very hot area of research in social and public policy. I think in relation to its effect on violence is something that I don't think we have studied and we need to study. However, in terms of its impact on other types of outcome, I think the benefit of the direct credit or cash, the way that as you mentioned, like the credits that's being received during the pandemic, is that even if you don't necessarily file for your taxes or apply for it, it will come to you. Here with EITC, they do need to file. They do need to file. Now, again, many people do so and receive it, but again, 20% of people are not receiving it. So in terms of the coverage might be a little bit different. Mm-hmm. But at the same time, that's just one facet of that. Because, for example, with EITC, there is this whole line of encouraging you to work, encouraging you to be employed. That causal pathway is unique to it, because then because of that, many other things downstream from the inducement of employment may be affecting violence. So I think empiric research should show and look at those head to head to look at their impact on different types of health. To my knowledge, and I definitely can check this out because this is such a great question, and I will definitely ask some of my public policy colleagues and scholars. To my knowledge, investigators have not looked at that direct head-to-head of the type of credit received on violence, at least. And I think that's a wonderful question because it informs directly policy. Many of these are concurrently going on. So EITC has been expanded. The whole, temporarily at least, the whole issue of not having a child and not receiving EITC has somewhat vanished in that now even people who don't have a child, they do receive a larger amount of EITC currently. So things have changed a little bit. And so those are concurrent also with other policies like child tax credit and direct credit. So that makes it for a very confusing, complicated policy picture to try to study on.
Complicated, but probably really unique opportunity. I think right now is there's never been a time, I don't think that we've had kind of this direct payments and sort of tax credits kind of at the same time.
I completely agree.
Yeah, wonderful opportunity. And I don't want to take up all of the question time, so please everyone jump in. But I'm wondering, have you done any kind of modeling, sort of economic modeling of the tax credit, the cost of the tax credit, and the reduction in economic burden for some of these forms of violence? So, you know, the supposition is that if you reduce violence, the economic burden goes down, but have you kind of done some economic modeling to look at what kind of reduction, you know, from a burden standpoint that we might be talking about?
Another wonderful question. No, we haven't done that, but we definitely, that's something that needs to be done as the next step. Now that we know the impact or we have quantified the effect size with some uncertainty, doing an economic analysis would be really helpful. We did discuss that at length in our research group because there was a joint initiative by Harvard School of Public Health and Robert Wood Johnson Foundation that you can find online, Drivers of Health. And there was a particular issue of Health Services Journal that published a series of papers on economic and social determinants of health. And our paper on risk and protective factors was one of them, which I'm happy to share with you. In that, we somewhat estimated that what could be the potential impact of EITC on, let's say, suicide or suicide attempt as it changes physical health and mental distress. But it wasn't really a formal economic analysis at all. It wasn't economic modeling. It was just very broadly speaking, this is how much money we are using on issues like prevention of suicide and also issues around physical health and mental distress. And this is how much we can benefit from the program. So I'm happy to share that with you, but it's not a formal economic analysis. And I have been involved and I have seen several other papers and projects where we try to look at the expenses of associated with violence and the burden of that in our society and different types of violence. And those are enormous, as you know very well. So there are opportunities to do formal economic analysis because some of these indicators as related to violence, involvement in criminal justice, criminal legal system, incarceration, physical assault, if you will, different types of child maltreatment, some numbers for them do exist. So I think that would be a wonderful next step for somebody who may want to, who have the expertise for formal economic analysis to actually take that on.
Yes, I think sometimes the challenge of getting policymakers to kind of integrate the science is seeing what the bottom line is, which sort of segues nicely into Dr. Runyon's question in terms of as you've disseminated some of your results, what kind of responses have you gotten from decision makers and agencies and or legislative bodies
That's a great question.
with your work to date?
Sure, thank you for asking. It's great to have you here, Carol. Very positive, very positive. For example, the Washington State that I mentioned, the Institute, the Center for Budget and Policy. We've been in conversations with them about this, and they have used some of the findings to really promote some of these policies in our own state in front of the legislature. One of the things I didn't have time to talk about is that whenever you look at the map of EITCs in the country, Washington State is a funny one. I say it's a funny one because some maps they show that doesn't have EITC, some maps show it with like dashed color, some show it with the solid color that has it. And the whole reason for that is we have had EITC on the books, but it has never been financed. It has never been funded. Until very lately, which is called working family tax credit. So it is a type of tax credit, but it's more, unique to Washington State. And so it has been, Carol, it has been used directly in informing some of those conversations. And as you know, different stakeholders react to these differently, depending on what cause they are more committed to. So, or they really care about. As Terry mentioned, for example, some really deeply care about issues of child maltreatment. Some others are really focused on suicide prevention, for example, which is a big, big issue, I know in Colorado, but also in Washington. So the beauty of this type of research, when it shows the impact of one policy on multiple risk and protective factors, is that you could engage a broader group or fraction or slice of stakeholders because you have something to talk about on multiple fronts. So my answer was long, but in short, it's been very positive, Carol.
Thinking of the sort of intersection and sort of buy-in of these sort of different intersections in kind of care, behavioral health care, and I'm wondering in terms of, and you may have mentioned it for next steps, I may have missed it, but surely there are some mediating factors in the link between the tax credits and reductions in some of these violence programs. Would you have any sort of theories of what some of those mediating factors might be? Could it be, for example, better increased access to medical care or behavioral health care, or I would think particularly neglect is maybe an easier one to see how sort of reduction or increases in sort of available income could result in better acquisition of some of those resources like food, clothing. But are there other kind of mediators that you might think are related to this reduction in these forms of violence?
That's an excellent point. And I think work on mediators both mediators and moderators need to continue, because in terms of moderators also is really important. We are doing some analysis across race, across gender, across different types of communities. Sometimes it's harder because the variables are really not great or the power goes down. But moderator is also really important because policies don't impact everyone in the same way. So examining the heterogeneity of effect is extremely important, because equipped with that, you may know which subgroup of the population you may actually need to focus on. But setting moderators for now aside and going back to your question about mediators, absolutely. The beauty of that type of work, and we had just 3 years of funds for this. I wish it was like a 10-year project, because there's so much still to be done. Work on EITC will continue. The beauty of what you just said is that there are indeed data sets that do have information about some of these mediators within the data set. So it's conceivable that actually formal mediation analyses might be done, especially for the data sets that individually track people longitudinally over time, to look at some of the factors you mentioned, such as financial security, the neighborhood, family stress, family conflict, intimate partner violence itself as a form of exposure for child maltreatment or others. There are opportunities to do that. In our work, we have published a couple of those, as I mentioned, such as mental distress, substance use, physical health, and a couple of ones that are hopefully will be published, I hope, sometimes in 2022. But there are still some of these variables that you see here that we haven't studied. And so for those that we have studied, we have indeed seen that a potential impact that goes through those variables. And so it would be really important because sometimes you're able to block that mediator or promote a particular mediator and increase the impact of the program.
Question from our other Dr. Runyon. Can you comment on Washington State's pattern of increased minimum wage and the findings of your earned income tax credit work?
We haven't looked at that specifically. That's a really good question. Meaning we haven't looked at it in the context of this study. We have just looked at minimum wage as a covariate, not as a central piece of information here, and certainly not in our own state. That's a really good question because there has been a very lively, as you probably know, line of research done by colleagues at the University of Washington and UC Berkeley on this issue here and minimum wage. But that's an excellent question in terms of putting the two together, actually, and looking at their relationship on some of these outcomes, which we haven't done that in terms of their effects together. But they have been studied separately. I think it will be really, or as a covariate of the other one, but I think it will be really important to look at it maybe jointly as well. That's another excellent.
Is that a little bit complicated too? As if the minimum wage goes up, but the earned income, the percentage by earned income tax credit doesn't sort of follow, that some of those increases actually decrease what you could get from earned income tax credit.
That's right. So it becomes a little complicated in terms of this scheme of how to actually construct the different groups in terms of how much they are receiving and what proportion of that is attributable to what. So definitely it's a more complicated picture. I think there is some recent research coming out of UCSF that is looking at how to look at some of the policies together at the same time. It's broader theoretically, not in the context of these 2 or 3 specific policies, but work on examining the impact of policies together is definitely emerging. It's complicated, but as you mentioned, Terry, I think it's really, really helpful and potentially closer to reality because the same population of Washington, for example, may be concurrently influenced by several different policies are ongoing at the same time. The working families tax credit I mentioned to you, for example, is something that's going to be subject of research for years to come by scholars here and maybe in other parts of the country. Paid leave is the one that's really, really important. It's coming at the same time. Parental leave, maternal and paternal leave paid. I mean, there is a lot going on that I think would be really important to think about moving forward as it relates to their impact on health.
Thanks, and we probably have time for one more question. Jing put a question in the chat box about the study limitations on the findings of the EITC on IPV and 2 sort of different levels of analyses, being state analysis of national crime victimization survey and individual level analysis of fragile families and child well-being. And how familiar are you with those kind of?
Yes, no, I'm very familiar with both of them, and we've run out of time. I'm happy to pick it up maybe offline, but I'll just to answer your question or to react to your question here before we say goodbye. I would say that there are many limitations. To give you an example from NCVS, National Crime Victimization Survey is a very respected, highly respected survey of crime victimization in the country, as you know. Many of the victimization events don't get reported to the police and law enforcement. That's the beauty of NCVS. However, NCVS doesn't give you identifiers. You have to go to some of these federal research statistical data centers to see the ID, the identification, including state. Secondly, it's not state representative, right? Statistically speaking, it's national data. It's not state representative. Now, Westat is doing an amazing job working with Bureau of Justice Statistics to create, via some really sophisticated statistical analyses, create state-level estimates of some of these outcomes. We use that. There's like an 800-page PDF, by the way, if you're interested, I'm happy to share with you, of a statistical modeling of this that generated state-level estimates of intimate partner violence. For example, for that type of work, we use that. But limitation, it's just a rate for each state. That's it. So you don't have any specifications of the features or the types of IPV or others. It's just one rate attached to one state, and you stop there. So you can't do stratification, contingency tables, and things like that. So that's just one example, but we have run out of time. I'm happy to talk about limitations of all of these really at length if you're interested.
Thank you. And so with that, thank you so much for the presentation. I myself have about 5 notes and probably 3 more years of research and work that I can think about doing now and adding into my own research. So thanks so much for the talk. And for anyone, if I think that your contact information is available or will be available if you want to follow up. And I do believe that this is going to be posted on Abby's webpage and YouTube channel. So thank you all for your attendance, especially thank you, Dr. Rowhani-Rahbar. We're so glad to have you, and please stay dry up there in Seattle.
Thank you very much. Take care.
Bye, everyone.
Bye.